Hello everyone and welcome to PharmaHut and Health. Today, we will be discussing the differences between these two medications Pseudoephedrine and Levocitrazine, their dosage, uses, and potential side effects. Pseudoephedrine. Pseudoephedrine is a decongestant that is commonly used to relieve nasal congestion caused by allergies, colds, and other respiratory illnesses. It works by constricting the blood vessels in the nasal passages, which reduces swelling and opens up the airways. Dosage. Pseudoephedrine is typically taken orally and is available in tablet, capsule, or liquid form. The recommended dosage for adults is 60 mg every 4 to 6 hours, not to exceed 240 mg per day. Uses. Pseudoephedrine is primarily used to relieve nasal congestion and sinus pressure caused by allergies, colds, and other respiratory illnesses. It is also sometimes used to treat mild cases of asthma. Side effects. The most common side effects of pseudoephedrine include nervousness, restlessness, dizziness, and trouble sleeping. It can also cause increased heart rate, high blood pressure, and in rare cases, seizures. Levocitirizine. Levocitirizine is an antihistamine that is commonly used to treat allergies, such as hay fever and allergic rhinitis. It works by blocking the action of histamine, a chemical in the body that causes allergic symptoms such as itching, sneezing, and runny nose. Dosage. Levocitirizine is typically taken orally and is available in tablet form. The recommended dosage for adults is 5 mg once daily. Uses. Levocitirizine is primarily used to relieve symptoms of seasonal allergies, such as hay fever and allergic rhinitis. It can also be used to treat hives and other skin allergies. Side effects. The most common side effects of levocitirizine include drowsiness, fatigue, and dry mouth. It can also cause headaches, nausea, and in rare cases, severe allergic reactions. In summary, both pseudoephedrine and levocitirizine are medications commonly used to treat respiratory illnesses and allergies. Pseudoephedrine is a decongestant that relieves nasal congestion and sinus pressure, while levocitirizine is an antihistamine that blocks the action of histamine to relieve allergy symptoms. It is important to consult your doctor or pharmacist before taking any medication, and to follow the recommended dosage and usage instructions carefully to avoid potential side effects. Thank you for watching. Please like the video and press the bell icon, and we hope you found this information helpful.